remember sitting in my car after a 14-hour day, hands on the steering wheel, silently asking myself, is this what the rest of my career is supposed to feel like? Be honest with me. Does it feel like medicine has become a cage? Like you're running from room to room, charting until midnight, fighting insurance companies more than you're treating patients, and somehow it's still your fault for being behind? I know that feeling. I lived it. But here's the truth. No one tells you you're not the problem. The system is. And there's a way out. I'm Dr. Ariana DeMers, the Queen of Business Orthobiologics, and I am leading the way in orthopedic surgery innovation, shaping medical practices for success. I'm going to break down exactly why so many brilliant, dedicated doctors feel trapped, and how you can reclaim your autonomy without burning out or abandoning your career that you love. We'll talk about the real cause of moral injury, the moment everything began to shift for me, and the framework I now teach doctors who are ready to step into their own freedom. If you've ever felt exhausted, undervalued, or stuck, stay with me. This might be the first time someone tells you the truth and gives you a real path forward. So why do doctors feel trapped? I remember sitting in my car after a 14-hour day, hands on the steering wheel, silently asking myself, is this what the rest of my career is supposed to feel like? And I was exhausted. I was empty. I was even a little bit angry. Every doctor I knew was drowning. Not because we're weak, but because insurance dictated everything. The number of patients, the time we could spend with them, our worth. We were practicing this factory medicine, not actual human medicine. And it hit me. I don't have to practice this version of medicine that the insurance companies created. There are ethical, evidence-based, patient-centered, doctor-centered alternatives, and they don't require permission from the billers. The shift began when I stepped into considering orthobiologics and regenerative medicine, considering cash-based care, considering long, unhurried visits with my patients, and considering real outcomes, real opportunities for healing, real opportunities for relationships with my patients. And that's when I realized doctors are not trapped because they don't have options. They're trapped because no one showed them the map forward. So how do doctors break free from the system? Here's the path I guide so many doctors through today. I guide them to step away from the insurance hamster wheel. You know, the one where you're running all the time. And no matter how fast you run, you can just keep going faster, 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 faster. And when we step away from the insurance hamster wheel, it's not overnight. It's strategically with a plan. And the plan includes integrating orthobiologics and regenerative therapies. This is evidence-based, patient-centered treatments that are not controlled by the insurance companies. We also rebuild your practice around your values: time freedom, lower volume, higher impact visits. You get to actually practice real medicine again. And we also teach about charging a appropriately for your expertise. Not just what the insurance companies decide you're worth, but what your skill, your expertise, your knowledge is actually worth to your patients. And we also teach you how to lead the future. Regenerative medicine is the next wave. And doctors who move now won't just survive, they'll lead. So what does freedom look like? Now, I want you to imagine that when you wake up in the morning, you don't wake up with that pit in your stomach, the desire not to go to work. You wake up and there's no pit. You walk into your clinic and you have clarity. Imagine spending time, like real time, not just 7 minutes, with your patients and getting to see them have transformation, to actually have those aha moments where they're choosing health, they're choosing wellness because you've been the guide. Imagine having both a practice and a life. Yes, it's possible. You can have both. I promise you, freedom is not a fantasy. I've lived on both sides. And once you're on the side of freedom, I will tell you, I will never go back. So here's the truth. Doctors feel trapped because the system was never designed for healing. It was designed for volume. It wasn't designed for patients, and it wasn't designed for doctors. And here's the secret no one tells you. You can step outside that system and practice medicine ethically, sustainably, and with autonomy. The ability to make decisions for yourself and for your patients. You have the first action right here in front of you. Just start exploring the path of orthobiologics and cash-based care. You became a doctor to help people, not to chase prior authorizations or ask permission from insurance companies. Your purpose is still alive. It might be deep in your heart. It might be buried under all of the stuff that we have to deal with every day. But you just need space to breathe again. If this resonated with you, if a part of you is whispering, yes, that is what I want, then stay connected. Please subscribe for more conversations about orthobiologics, PRP, cash-based practices, and reclaiming your freedom as a physician. And if you want deeper guidance and real tools to get started, please join my newsletter. It'll help you. We are not just learning here. We are building a movement of doctors who are taking back medicine.